Dr. Haywood is the Associate Dean for Diversity, Inclusion, and Student Affairs at GW University School of Medicine and Health Sciences. She has been a long-time leader at GW, holding positions such as the Associate Dean for Student and Curricular Affairs and the Associate Professor of Emergency Medicine. But I know Dr. Haywood as an eloquent and outspoken leader and a voice for prevention of domestic violence and a voice for the importance of educating healthcare providers how to identify and respond effectively. So with that, Dr. Haywood.
Good morning, and thank you for taking time out of what I know are busy schedules to spend a few days here in Washington. It's actually been more than 30 years, but I still have a small scar, a keloid, on the inside of my lip to remind me of a late night visit to a local emergency department after my husband punched me in the mouth. My visit was largely unremarkable, as I recall. I was asked, "What are you here for?" "I was punched in the mouth," I responded. I didn't say, "It's not the first time." I didn't say, "I don't know how much longer I can live like this." I didn't say, "Please, somebody, anybody, help me make it stop." I just wanted to stop. Instead, I waited patiently until the doctor came. He performed what I now consider an expert job at suturing my lip. Today, there are no telltale signs of the violence of that night. Just as he was completing the job, he looked up at me and asked, "Who did this to you?" I will never know what made him ask that question, but I do know that no one had asked me that before. Not the registration clerk who took my information, not the nurse who took my blood pressure and ensured that I had been vaccinated against tetanus, and that my last menstrual period was regular. Not the technician who cleaned my wound in preparation for the suture job. So for one moment, when he asked, "Who did this to you?" I became hopeful. I hesitated as I thought what it would mean to confess that the person I loved and who I thought loved me was responsible for this. I answered, "My husband." The doctor looked sternly at me for a few minutes before he responded, "You need to learn how to duck." So I spent the next several years trying to learn how to duck, when I should have been learning how to stay safe, how to keep my children safe, how to leave. I'm often asked, "How did you get out of that relationship?" And what I know now is that it was the knowledge and encouragement of family, friends, my children's pediatrician, a professor in one of my college classes, and innumerable kindnesses from people whose names I don't know. Professional people, simple people, but people made it possible. What was lost that night in the emergency department was the opportunity to offer hope and compassion to a young woman who needed help. A simple, "You don't deserve to be treated like that," or "It's not your fault," would have sparked that hope, the hope I desperately needed. Yes, that night could have ended with doing what doctors are supposed to do: to heal, to make whole or sound, to help a person reconvene the powers of the self. So here I am today, a practicing emergency physician myself, remembering that night nearly every shift as I sort through the complaints of my patients, remembering that some things aren't spoken out loud, and you have to dig for them, even when you don't feel like it, even when you don't want to. Even me, a victim, I need to be reminded that hope and compassion are great medicine, not just nice words that pacify. Providers need to be trained. They need information, facts to present to patients, just like the facts on cardiovascular disease or lung disease or liver disease. The facts in domestic violence help victims make wise decisions. We must continue to raise our voices so that no one is stuck thinking that they should simply duck. Thank you.